The one responsible, normally in some jurisdiction, they have a commission. In Ghana, we have an AMR group at the Ministry of Health. So they are responsible to all the action plans that has been made and make sure that we are following the action plan, the strategic plan to the letter. They are doing the monitoring. They are also doing the evaluation and assessment and trying to do things which maybe have been done better during the first plan of action. So they are the people responsible. So that's in the Ministry of Health, which is responsible for AMR. So this is what is done. But if you go down in every region, in every district, in every health facility, as I said, there is a quality assurance team which look at all these things. It's part of it. The AMR, infection prevention control, and all these are part of the quality issues. And then the processes, the outcomes, and all these are done together as a system to have quality assurance in every hospital. The way that we do these things is, there are a lot of irrational prescription. There are a lot of people who are bringing in medicines which are not the right type of medicine, what you call the fake medicines. There is also people who are not too sure what they are doing because they are not well educated in these things, also begin to do things on their own way. So what should be done and what we are doing is that first, especially general practitioners are all encouraged to use antibiotics and drugs even sparingly. No patient wants to have a jab anytime he goes to hospital. The number of even medicines that you give to a patient is very important. It tells you the quality that you are doing. There are a lot of things you can do just listening to the patient and then face to face and advising the patient. So we have to spend more time with the patients, understand what they have, do a lot of examination, do a lot of diagnostics, and then you can combine all of it and make a meaningful diagnosis and then decide what you're supposed to give. These are new, there are a lot of new guidelines in our professional training so far as prescription is concerned. So that one we do it from when you are in school through your practical life. And there should be a continuous training for all prescribers and then the nurses and laboratory people, everybody who is a health professional should have continuous training. And then also the new things that we have, new antibiotics that are coming on board, new innovator drugs which are coming on board, and all sorts of things. And then we have to have a push to also reduce, especially infection following surgeries. This is where we have problems of, because any patient who is coming for operation should be well educated and will go through the infection prevention and control, both for the patient and for whoever is going to do the operation or manage the patient, so that the patient doesn't take something from the hospital. Normally, hospital-acquired infections are very difficult to manage because most of the acquired infections are a mixture of antimicrobial resistant organisms. So you want to make sure that they don't have it. And then there should be groups in the hospital. There should be groups, especially at the departmental level, to make sure that people know what is happening. A sort of operational researches which should go on in various departments where they use antibiotics and other antimicrobials, and then compare. Some people do, during this assessment and monitoring, they even do a table and tell you how many antibiotics everybody is prescribing, especially if you have about 10 doctors there. You can black in the name of everybody and then leave your name out, and then if you are number 10, then others are number 1 and up to number 9. So you don't know, then you feel that, yes, you have to do better, and then continuously be training you. And above all, the public health activities that you do also should be geared towards education, in especially infection prevention and control. So public health activities in health promotion, health education should teach both the practitioner, whoever the professional is who is going out, and also even the client or the patient who sees them. So these are the things that we have to do continuously and make sure that once you do that and it's established into the system, into the health system, then everybody knows that in this particular place, this is what we do. In fact, there are areas where some of us got our training in surgery. Everybody knows that if you do this, if you go in to do a case which doesn't involve much of contamination, sometimes you don't give anything at all. If it's a potential contamination, you give what antibiotic prophylactic just before the operation. If there's infection, you manage the infection according to what your laboratory results tells you, so that you tackle the patient, tackle what the organism is. So when anybody is having signs and symptoms of postoperative infection, quickly, you just don't say that let me give the person amoxicillin or let me give the person rocephin or this thing. No, you want to know exactly what the organism is, and then you manage the organism. Sometimes you can have multiple organisms. Then it tells you it's resistant to this, it's sensitive to this. So you give this one which is sensitive to. And most of the time, you want to make sure that you don't have to make the patient be resistant to a lot of very good and very cost-effective drugs, but very expensive drugs. Then any health manager who is in the hospital will know that you are not managing my patients very well. And sometimes you can be sanctioned as a prescriber if it continues like that. Because what it means is that you are making the hospital lose a lot of money. And this one comes in especially where we have a health insurance system which reimburses along what you call the DRGs, diagnosis-related grouping. So you come there of chest infection, it's pneumonia. They give you money for this is what you have to treat the pneumonia of. And if you're not very careful, you have to use very expensive medicines. Your hospital will be losing. And they'll tell you if you come for cesarean section, you lie in the hospital for maybe 48 hours or 72 hours. So if you have cesarean section and every time after cesarean section, the patient gets infection and has to lie in the hospital, has wound infection, the wound gives, you have to go in and clean the wound and suture it again. All this, the patient lies down there for about 2-3 weeks. Nobody pays after the 3 days. These are measures that are put in place to make sure that quality issues are tackled and tackled head on. And that one, there's motivation to it. So the quicker a patient gets well, without any postoperative infection, without any very long, prolonged infection which cannot be treated, the better for the health institution. You collect your money, like somebody who keeps the patient there for weeks. You will not be paid the same amount. And that means nobody in the hospital system pays any extra money. So health insurance is very, very important because he is the payer. So you should determine this. And in any quality assurance system you put in place or you put in a country, for example, you have the National Drug Treatment Guideline, National Drug List and everything. Health insurance is very, very important. In fact, to the extent that sometimes the private health insurance is also very important because they also pay. They don't want to pay for things that doesn't work. So we put all these people together, and some countries will develop what we call a commission, national commission, which looks at these things and is very important in the health system. That should make people who will be looking at all this